Good afternoon, everyone. My name is Tom Moore Davis, and I would like to welcome you to the Activ Doctors Online March webinar. March is National Colorectal Cancer Awareness Month, and in honor of that, the topic of discussion today will be colon health and awareness. In today's webinar, we will be looking at the anatomy of the colon, the colonoscopy procedure and signs of a healthy colon, and some of the conditions that affect the colon. Our expert speaker today will be Dr. Zahalsky. Dr. Zahalsky has been ADO's US Medical Director since 2010. He received his bachelor's degree and medical degree from Brown University and did his residency at Johns Hopkins University. He's the former chairman of the Department of Primary Care at Virginia Hospital Center and holds multiple university teaching assignments, including clinical assistant professor at Georgetown University. Welcome, Dr. Zahalsky, and thank you for joining us today.
Thank you for inviting me, Tom. So today we're going to be learning a little bit about the colon, what it does, how it does it, and specifically what kind of conditions might affect the colon and play a risk to your health. So to start with, I want you to take a look at this picture of the colon. I'm going to remind people who are listening to our webinars for the first time that when I describe pictures of body, I'm going to transpose left and right. What you see on the left of your screen is actually the right side of the body. It's as if you were looking at somebody facing you. And so what you see on the right side of your screen is actually the left side of the body. So here you see the colon, or large intestine of somebody, and you'll notice that it kind of wraps itself around your belly, your abdomen. The colon actually starts on the right side where you see the little arrow pointing to ascending colon, right near the appendix. The food that you eat gets digested and churned into waste material, and a liquid waste material will enter your colon at the ascending colon right near the appendix. It's the job of your colon, in fact, the main job of your colon is to dehydrate that waste into stool so that you don't have constant diarrhea. When the stool first gets into the colon, it is very, very liquidy, and the colon has to reclaim all of that water so that you don't get dehydrated. So the stool, the liquid stool, goes into the ascending colon, goes up to the kind of the right edge of your ribs, crosses to the left side in the transverse colon, comes back down towards the bottom of your belly in the descending and sigmoid colon, and then hopefully now fairly solid stool comes out through the rectum. The main problem that we worry about with the colon in the healthcare field is colon cancer. Colon cancer is responsible for the largest numbers of preventable cancers in the United States. It's actually the second leading cause of cancer death among men after lung cancer, and the third leading cause of cancer deaths among women after breast and lung cancers. But most colon cancers are completely preventable, and that's something that we're going to learn about more as we go on. So as I said, for doctors, the main dangerous thing that can happen with the colon is colon cancer. And again, this is completely preventable, and we'll go through why as we go to future slides. But the way that we prevent it is very straightforward and, relatively speaking, easy. This is a colonoscope. This is a tube that can go up through your rectum, as delightful as that sounds, and weave its way through your colon and look for polyps, which are the earliest signs that you could be at risk of developing colon cancer. Current recommendations are that you get a colonoscopy every 5 to 10 years, usually starting at age 50. All colon cancers start as polyps. Polyps are little pouches off of the colon, little flaps of skin that will grow and grow and grow and will ultimately become colon cancer. But it takes 10 years for a polyp to start and grow all the way to colon cancer. So as long as you're good about getting your colon cancers, getting your colonoscopies, the polyps can be found, identified, and even removed long before they can become colon cancer. So the colonoscope is a flexible instrument. Using the controls, it can wind around all the way through your colon and get all the way up the descending colon on the left, across the transverse colon, and then down the ascending colon over to near where your appendix is. Now, when you're using a colonoscope, if you were to just try and stick a colonoscope into someone's colon, you wouldn't see very much. It's kind of like trying to look at the inside of an inflated tire. The walls of the colon collapse on themselves when there's no stool there, and so you can't actually see very much. So we actually use carbon dioxide, and this gets pumped through the colonoscope to gently inflate the colon so that you can actually now see the inside as if you were looking again at the inside of an inflated bike tire. The colonoscope, you will notice, has a little light on the end so that you can see where you're going when you're using the colonoscope. Usually these lights and the tips of the colonoscope are hooked up to a camera, and the gastroenterologist, which is the type of doctor that usually does colonoscopies, is looking at a screen as they do the procedure. You can also put several tools through the colonoscope. So if, for instance, as we'll learn in a little bit, you want to get rid of a polyp, you will be able to put tools all the way, weave around through the colonoscope so that you can handle those polyps or any other problems that might come up as you are using the colonoscope. Now let's go on to what we're going to actually see when we're using our colonoscope. So here is a picture of normal colon. This is what the colon looks like when the doctor inserts the colonoscope into your colon. As you can see, it's kind of shiny and glossy and fairly smooth, but it's not strictly a tube. It's not a nice even tube. There are these ridges, these lumps, and those are actually muscle layers. Those are the muscles that are responsible for contracting to move the stool, both the liquid and the solid stool, through the colon so that everything moves in the right direction and hopefully you don't get constipated. Now there's a couple of different types of structures of your colon. This is your typical colon for the beginning, the ascending colon, and the end, the descending colon. But your colon can look different in different places, as we'll see on the next slide. This is the transverse colon, the part that when it goes from the right to the left side. And again, it's known as the transverse colon. And this part of the colon can actually seem triangular. This is perfectly normal. And again, you see those muscular ridges that serve to pump the stool from one side of the colon to the other. You'll also see, looking at the picture, what seems like blood vessels, especially there at the left side of the slide. Those are totally normal. The colon is a very vascular organ, which means it has a lot of blood supply because it does a lot of work. It's always pumping stool along, and it needs a lot of good blood flow to keep those muscles energized. All right, who can find the problem with this slide? It's pretty easy. This is what's known as a colon polyp, and this is a fairly good-sized colon polyp. You can see how you have the smooth wall of the colon over on the left side of the slide, and then a little stem leading to this thing that if you saw it growing out of your yard, you would assume it was a mushroom or something. This is a colon polyp, and most colon polyps, fortunately, are pedunculated or have those stalks or stems that are attaching them to the side of the colon. Fortunately, the stems themselves usually are not a problem and usually are not dangerous, but that massive middle part is the part that can, if left untreated and ignored for 10 years, turn into a colon cancer. This is when you want to capture a colon polyp and take care of it before it becomes cancerous. And take care of them we can. This is a artist's illustration because we can't actually take a picture of the colonoscope itself from the colonoscope. So this is an artist's interpretation of what it looks like to get rid of a colon polyp. As I said, you can stick through the colonoscope a variety of tools, and in this case, they're using a heated wire. What they can do is stick a loop of wire through the colonoscope and wrap it around all the way around the polyp and then cinch it or tighten it around that little stem. They then put high heat levels through the wire and essentially burn off the stem, causing the polyp itself to fall into the colon. They then take out the wire and put some tiny little forceps through the colonoscope and grab the polyp and then pull that out of your body. And then we usually send it to the lab to verify what kind of polyp it is, because there are a few different types of polyps. In this way, we have completely usually gotten rid of the entire polyp and any risk of colon cancer that goes with it. Now, it's worth noting that you're supposed to get colonoscopies starting at age 50, as I said, and usually every 5 to 10 years, because it does take 10 years for a polyp to become a cancer. We don't usually recommend you wait the full 10 years. 5 to 7 is usually considered better, because on the off chance that the gastroenterologist missed a tiny little polyp on the last one, we wouldn't want you to develop colon cancer between 2 colonoscopies. Now, you're probably thinking as you look at this slide, wow, that must hurt, putting a hot wire inside your colon and burning off the stem of a polyp. In actuality, this is not at all painful. Your colon actually has no pain receptors inside of it. Why would it? Usually people aren't poking around in their colon. The only kind of discomfort that your colon can feel is from actually being overinflated. If you put a little bit too much carbon dioxide, that's going to cause crampy pain, and that's why when you get constipated, for instance, and your colon gets stretched, you can feel belly pain from that. The only type of discomfort receptors that the colon has are related to being stretched too much, but there are no heat or tearing type pain receptors like you might have on your skin. Now, what happens if you don't get your colonoscopies on a regular basis? What happens if we aren't able to find and remove these colon polyps? Here you have a colon cancer. You can obviously see that this looks a whole lot more ominous than even the polyp, even the large polyp that we had on the previous slides. This is attached to the wall now. It no longer has that nice little stem separating it from the wall of the colon. You can see over on the left side of the polyp where it looks more red, it's probably bleeding a little bit, and it's actually in danger of blocking off the colon, and that can be a calamity. You're no longer going to be able to get rid of this with a colonoscopy. The colonoscope is not going to be able to separate this from the wall and pull it out. This is when you actually have to end up getting surgery to get a cancer like this removed. Although you can use the colonoscope to biopsy it to make sure that it's colon cancer, but looking at something like this, the gastroenterologist would have absolutely no doubt that what they were looking at is a colon cancer. So there are other conditions that affect your colon that fortunately are usually a lot less dangerous than colon cancer. The single most common other problem that people get with their colon is what's called diverticulosis. Diverticulosis are little pouches that come off your colon. From the outside, they kind of look like little grapes growing off of your colon. From the inside, it looks like little holes in your colon. And what happens is years of pressure, particularly in the descending colon, the one on the left side of your belly, by which point the stool is getting harder, is causing pressure on the inside of the colon. And this pressure causes some weak spots to develop in your colon that pouch outward, kind of like a balloon getting blown up over and over. It gets a little stretched out in focal places, and you have these diverticuli. They're little pouches. Fortunately, you would think the big risk here is that they're going to pop. Most of the time, they do not pop. However, they do have an ugly tendency to bleed on occasion and can bleed quite a bit. The other thing that can happen is that they can get infected. Little food particles can sometimes get caught in these little pouches, and that can lead to infection, and we call that infection diverticulitis. You can usually treat that with antibiotics, but both diverticulitis and bleeding due to diverticulosis can both be very serious problems. Since we've been talking a lot about colonoscopies, I just wanted to show a picture of what a diverticuli or diverticulosis look like from inside your colon. And again, they look from the inside like little holes in your colon, almost like you have a Swiss cheese colon. But in actuality, they're not holes, they're all little pouches that are coming off of the colon. If you actually get a hole in your colon, it's a disaster because the stool will start to leak into your abdominal cavity, and that's something that you need emergency surgery for. So you would never see a picture like this of an actual hole in a colon. Usually when someone has diverticulosis, the typical medical term that you would put them on is what's called a low residue diet. The type of food that can get caught in these little, we call them ticks, and cause infection are little seeds. So for instance, we try and have people avoid strawberries. Those little seeds on the outside of a strawberry, you probably never thought of them before, but they have an ugly habit of getting caught inside of these diverticuli. Any type of fine nuts or small berries with tiny seeds are considered bad offenders at contributing to diverticulitis or infections of these little pouches. Here's yet another condition of the colon that tends to get doctors really concerned. This is a picture of the inside of someone's colon. As you can see, it no longer has that nice, even, smooth texture. It's lumpy all over, and this is called familial polyposis. This is a genetic condition where people start to get polyps at a very young age, usually in their teens. And by the time they're in their 20s and 30s, they can have hundreds or thousands of polyps throughout their colon. These polyps tend to be more aggressive and even more likely to develop cancer quicker than a typical colon polyp. As a result, people who are found to have familial polyposis often need their entire colon taken out at a relatively young age in order to prevent the development of colon cancer. So if you have a family history of colon cancer at a particularly young age, we will usually start doing colonoscopies earlier, and if unfortunately we find that you have familial polyposis, more aggressive treatment may be necessary. Now, after looking at all of this, I'm sure there are some of you out there saying, oh my God, I don't like the colon cancer, I don't like the colon polyps, I don't like the diverticuli, but a colonoscopy just scares me. Now, even though I told you that your colon doesn't feel any pain, the thought of getting a colonoscopy, of getting something shoved up there, is very distressing. And I haven't even really talked about the prep. In order to get ready for a colonoscopy, you need to drink some strong laxatives, usually for 24 hours, to clean out your colon so that we can see all of your colon and we're not going to have a bunch of stool in our way. And you put those things together, and causes a lot of people to delay getting their colonoscopies, even knowing that colon cancer is a relatively large killer in terms of cancers, and even though you know that the colon cancer can save your life, that the colonoscopies can save your life from colon cancer. So they have developed a new technique called virtual colonoscopies, and in our tech-oriented society, everybody wants everything virtual. Well, this part of the talk is to tell you why I actually don't like virtual colonoscopies. This is a picture here of what the virtual colonoscopy looks like. As you can see, while it looks maybe a little cartoony, it actually is an excellent representation of what the inside of your colon looks like. And in this case, the virtual colonoscopy has found the polyp. There's two big reasons why I'm not crazy about the virtual colonoscopy. Number one is you still have to do the prep. As bad as the colonoscopy is, the prep is probably the worst part, where you have to take the laxative and you end up going to the bathroom a lot of times over 24 hours. By the time you actually get to the colonoscopy itself, where they're able to gently sedate you and make you not feel very much of anything, that's going to be the easy part. But even knowing that you'll still have to do the prep, there are still people who don't like the idea of the scope actually getting inserted into your colon. And because of that, want the virtual colonoscopy instead. Here's the second problem. Somewhere around 40% of people actually have a polyp, as this person does. Do you know what happens for somebody like this? They need the colonoscopy anyway, because the virtual colonoscopy can't actually do anything about the polyp. It can only see it. So you have to do the whole prep all over again, and you still end up with the colonoscopy. So in the end, almost half of all people end up needing two procedures, two preps, rather than just getting one prep and doing it, quote unquote, the right way from the start. So if you know that there's almost a 50-50 chance that you're going to need the colonoscopy anyway, and that there's a 50-50 chance that you're going to have to do 2 preps, most of the doctors I know think that the smart way to do it is just to do the colonoscopy in the first place. So how can Activ Doctors help you with regard to your colon health? Well, there's a lot of ways. First, with our revolutionary personal health record, we allow you to be in control of your health information and take it anywhere. You would not believe how many of my patients can't remember the dates of their last colonoscopy. This can result in colonoscopies either being delayed too long, putting you at increased risk of colon cancer, or being done too quickly, and who needs an early colonoscopy? If you have control of your records and can take them wherever you go, and if they're not in your doctor's hands, you're always going to have the information that any future doctor needs to provide you the best and most time-appropriate care. Next, with our online second medical opinions, difficult cases, such as maybe someone with complex polyps or colon cancer or even familial polyposis, can have access to some of our top medical experts from around the nation and around the world to help guide you on what the best treatment for your individual condition might be. And finally, with our e-consultations, if your doctor participates with our Activ Doctors Online's website, we can allow you to talk directly to your doctor through our video platform so that you don't always need to go to the office to get all of your results. Now with that, I'm going to turn it back over to Tom, who can tell you about getting connected with Activ Doctors Online and starting your free trial with Activ Doctors Online.
Well, I'd like to say a big thank you to Dr. Zahalsky for that very informative and interesting presentation. Our ADO vision is to educate, engage, and empower members to take control of their health destiny, to save time, money, and even lives. We hope you've enjoyed today's presentation, and we invite you to start your free 30-day trial over at Activ Doctors Online and by clicking Get Started. For more information or to schedule a demo, you're invited to contact either Dr. Zahalsky or myself using the email addresses on screen now. And you can find us on all the major social networking platforms by searching Activ Doctors Online. Thank you all for watching, and we look forward to seeing you next time.